again. Welcome to another episode of Under the White Coat. I'm Sam Elfassy. I'm a gastroenterologist and a co-founder at Keops. At Under the White Coat, we get to know physicians, try to get to know a little bit about the physicians themselves, and try to learn something new about projects that they're working on. Today, I'm very honored to have a friend and colleague, Dr. Bram Rochwerg, who's a critical care physician and the site lead at the Juravinski Hospital in Hamilton. He's also an associate professor at McMaster University and a Master of Health Research Methodology, and on the executive of the Canadian Critical Care Trials Group, which is doing very important work right now during this COVID crisis. Welcome, Bram.
Hi, Sam. Thanks for having me.
Honestly, my pleasure. Always have fun whenever we get together and we chat. And I thought this would be great so we can have some of our listeners get to know you a bit more. Always an entertaining guy and very smart and really knowledgeable in many areas. And I think, you know, especially with COVID right now is very interesting times. I'm sure you can give us lots of different insights in different parts. So under the White Coat, what we do is we try to get to know physicians a bit better and key opinion leaders. So why don't you tell us a little bit about yourself?
Yeah, I don't know if I can live up to that introduction, but I will. I'll do my best. As you mentioned, I practice ICU medicine as well as research here in Hamilton at Hamilton Health Sciences and associated with McMaster University. I actually grew up in Hamilton, just a small town just outside Hamilton, and my wife's actually from the area as well. So we both did undergrad in London, both went to medical school in Ottawa, and then made the decision to come back home for the rest of our training as well as to practice. And it's been really nice actually getting to work in Hamilton in a community that I grew up in. One of the hospitals I work at is actually the hospital I was born in, which is a cool and unique experience. And so we live here in Hamilton. We have 4 boys between the ages of 5 and 9, which also makes it really handy to have grandparents close by that can help with babysitting. Maybe not as relevant during COVID. Some of them want to keep their distance, but usually quite helpful. And life is survival, you know, with young kids. You know how it is yourself, and balancing clinical responsibilities, administrative research responsibilities. The one thing is I tend to travel for research, and obviously that hasn't been the case in the last while. So that's been a little bit of found time. Yeah, I think those are the main highlights. My wife's a family doc now in the city.
That's awesome. The one thing we were chatting about was, you know, I think COVID obviously is a very big topic around the world, not even just in the medical space. It's leaked out that people are discussing it everywhere, and obviously it's impacting so many people's lives in many different ways. I'm not as active on Twitter. You know, I twiddle around on it and throw out some tweets once in a while. You know, one got me, I wouldn't say in trouble, but, you know, I made a little tweet and it got picked up. And then, you know, I was interviewed in the Toronto Star about something I tweeted about in COVID, and it led to a radio interview, not really the point of what I was trying to get at when I just made a little response to someone's tweet. But I know you're definitely a lot more active on social media. And, you know, I definitely follow you. I find you very interesting, very good insights, comments. And so, you know, tell me, especially around this time of COVID, how is sort of your social media usage or, you know, messaging sort of changed, or have you been always sort of active in that space?
Yeah, I think there's been so many advantages or good things and bad things to have come from this pandemic, Sam. And I think that, you know, you look from a research perspective, the amount that we've been able to accomplish in the last 8 or 9 months in terms of addressing a new disease and what's been able to high quality stuff that's come out is unbelievable, the pace of what's been. But on the other side of that is that misinformation, as you know, is rampant, both not just in the public sphere, but I would say also even in the medical community. There's a huge amount of misinformation, and I think it's inherent on us to try and address that misinformation. And I have been trying I think we all have to, but I have been trying to do my part in the medical sphere. I do that through guideline work, and maybe we can talk about that at some point as well. And then through the public sphere, I do try to use my platform on Twitter to be a voice of directing to trustworthy sources and trustworthy information. And, you know, in the past, I found I was an intensivist. Nobody finds that exciting. Nobody wants to talk about that. But I think as physicians, you have provided your own example, and I've had them as well, as this is sort of our 15 minutes of fame, and so much that all of a sudden the rest of the world cares about what we do, wants to hear about experiences of medical professionals in the hospital, wants to hear our input. And I think it's our job to stand on that pulpit and to give trustworthy information, to push away from all those that are disseminating misinformation and disinformation that's out there. So I have had the opportunity through Twitter and otherwise to, you know, do some media work, whether it be through radio, print, on TV, which, being honest, I actually enjoy it. I think it's fun and interesting, but I think it's also our job as well to address this. So I have been doing my best to say yes if asked, and do my best to try and get around all the confusing and unclear information that does get disseminated.
Yeah, that's great. I definitely find your tweets and information. I've definitely read some of the articles that cite you, so I'm always happy to see that. And it's great to see some, very, important topics that you're talking about, especially during COVID, and giving out, correct information. I agree with you. On Twitter, it's very polarizing. You'll see some very extreme views on different ends. What's your opinion on, I think you speak from a very high level academic center, part of, research trial groups, for other, community physicians or, other physicians that maybe don't have as much of a platform. Do you suggest that they become a bit more involved, or what's their role, especially around sort of dispelling some of this misinformation?
Yeah, I mean, I think everyone, even in their own community, can play a role. And I even found at a hospital level is that there was misinformation amongst our nurses and amongst our allied healthcare workers, even in our own ICU. So early on in the first wave of the pandemic, I started a little YouTube series along with our manager where we would do Q&A sessions. So the nurses would write down questions that had come up around the unit. And some of them were around care for the patients, but some of them were just like, I heard that COVID can get spread on toilet seats. Is that true, right? And so we do a little Q&A session where if I had the answers, I would provide them. If I didn't, I might look it up, or I would direct people to them. And then we'd post these videos on YouTube or amongst the unit just so that the nurses and RTs and other docs could go on and watch. So there's an initiative that, it doesn't matter where you practice, you can help deal with misinformation even within your own workplace. Or even within your own community. But I do think that there's a role for all of us. Nobody wants to speak beyond their comfort zone or what they're feel like an expert to speak on, but even directing to more trustworthy sources. And, from a medical professional perspective, that's where I do think things like clinical practice guidelines and trustworthy sources, which we've been working on producing as well, can be relevant for healthcare workers that might not have the evidence-based bent that those that practice in academia do have.
Oh, it's great. I never thought of that. I think we just off the cuff chat about these things at the workplace within colleagues and with the nurses, allied health. But definitely, I think, maybe formalizing that makes it definitely a lot more effective.
We found I couldn't reach out to have the same conversations with every nurse all the time. And a lot of them were having the same questions or the same concerns. And that's where this idea of this short YouTube series Q&A session came from. And the corporation ended up, they thought it was a good idea and did a little highlight story on it and this sort of stuff. So, like I say, I think there's role for everybody in helping to deal with this misinformation.
Yeah, that's incredible. I wonder how could we also help disseminate that even more amongst amongst our patients and in our communities, right? I think a lot of information is just really learned, just word of mouth and on popular media, but maybe having a bit more of a physician voice. I love seeing some of my colleagues that I know personally on the news all the time and speaking about these things. And so it's been great from that standpoint. And especially like my ID colleagues who, you know, maybe a small little secret, if I didn't go into GI, my top three were cardiology, GI, and infectious disease. I wanted to do infectious disease. So you know, I'm a little jealous right now because it's definitely their moment, but it's great to see. And it's great to see some of our colleagues really stepping up and helping with that.
Yeah, that's the hard part. I 100% agree. And that's the hard part on social media, right? On Twitter, you see it all the time, is that it's a forum for everyone who thinks they're an expert all of a sudden, and everyone's got their input. And there's great advantages because I think some of our colleagues in ID have been such amazing voices of reason and have gained Twitter followers and little blue check marks and, you know, provide a platform for disseminating trustworthy information. But then there's so many people that present themselves as experts and dispel information that is far from the truth. Sometimes, I mean, even doctors on Twitter and social media dispelling information that's far from the truth. And it is scary sometimes and concerning. So you know, in all regards, social media can be both a blessing and a curse, I think, when it comes to this.
Yeah, no, I totally agree. So yeah, you know, one other thing that I found during this time of the pandemic, you know, I think the whole world is going through this. Like virtual has just become the rule, right? Virtual care with patients. Our meetings are, you know, over Zoom. You know, I miss getting together. We haven't even been able to see each other, you know, more than across 200 kilometers on internet connection. But you know, there's definitely some advantages. I think being effective in being able to collaborate and work together, or you know, bridge different countries and collaboration groups. I think, you know, my opinion is has become a lot more easier, a lot more buy-in. Now people are much more aware of how to do this. How have you found that collaboration during this pandemic? And do you think going forward after the pandemic, hopefully everything settles down soon, are things going to be different going forward?
You know, from a clinical care perspective, it hasn't changed much for me, at least. I can't intubate patients over Zoom or put in central lines over Zoom. So we've obviously clinical work has all still been face-to-face, but research, Sam, this has been a significant change. You know, I told you I used to travel a fair bit. You know, once a month I was getting on an airplane and going to Europe or Asia or the US for research meetings or presentations, and this is stopped completely. And I think that we all have gotten a little bit more used now to the virtual environment and collaborating via Zoom, and it has provided cool opportunities for engagement. And I do think that there will be a new norm post-COVID. But there's certainly challenges too. And, you know, there is sometimes still no substitute for face-to-face. And I do think it has had an impact on, to some degree, our ability to collaborate and move projects forward that has been limited by the inability to get together. And, you know, it's the softer moments. Like we have conferences, I'm sure you've done the same, conferences via Zoom, conferences via platforms. And fine, you can get the science, but you're always distracted a little bit checking your email or doing other stuff while you're also watching. And so much of these conferences is the non-talking time where you're sort of chatting with colleagues, getting to know colleagues, going for a beer and getting a feel for how their practice is different than your practice and developing those personal connections. And that's still so important in our specialty, both clinically and from a research perspective, is those personal human connections. And it's been lacking in the last 8 or 9 months. And we've actually, I find, had to go to that extra effort to maintain those personal connections, which are so crucial to all aspects. And so although I think that some aspects will continue on post-COVID and maybe more virtual and a little bit less face-to-face, I think it's so important that we don't drop that completely, because we're social animals, and it's so important that we don't lose that, because there's so much value added there, I think, as well. You know, you see it in not just in medicine, but I think even, I don't know, you see the Toronto housing market and the fact that, you know, everyone's moving out into the suburbs because they realize you don't need to be in Toronto to work in Toronto these days. And I think that there's going to be life lessons for everybody. Like, I think the whole idea of commuting 5 days a week is never going to come back the way it was. And you're going to be in a scenario of maybe a couple days a week driving in, but working from home is going to become much more the norm overall. So I think this transcends medicine, but even beyond medicine. What do you think?
Yeah, I totally agree. I think there's definitely been some pros and cons. I think you know me very well. I'm a very social person. Just chatting with my wife, we're watching a show last night, and they're out to a restaurant. I'm like, oh my God, do you remember going to a restaurant and having a drink and being with your friends? Like, definitely miss a lot of those things. From a work standpoint, things that I've sort of been working on. Have been a lot more efficient, being able just to work from home. You can jump off one meeting, jump onto another meeting, definitely lose some of that social connection. But at the same time, from an efficiency standpoint, I think there is some things that we've gained. So at least there's some beneficial trade-offs. I know your work on guideline writing and clinical trial groups. Are there any cool projects you're working on right now? And maybe also in that context, has it become easier to work on that project today, or collaborate with people that maybe you wouldn't have been able to collaborate with?
Yeah. One really cool opportunity I think I sent to you was that I recently had the opportunity to chair WHO guidelines on drugs for COVID, specifically around a drug called remdesivir and another one on lopinavir ritonavir. And so these were WHO guidelines on treatment, international guidelines, and myself and an infectious disease from London, England, by the name of Mike Jacobs, were the chair. And this was a fantastic opportunity. Through the connections, McMaster is one of the leaders in evidence-based medicine, and through being able to work at this institution, develop these opportunities, and working with an international panel. We had representation from Asian countries, African countries, Europe, Australia, Japan, and having all these folks on a call and coming up with recommendations and guidance for management of COVID worldwide was a fantastic experience. Very, very fascinating, and definitely facilitated by the fact that we were able to do this all electronically, as opposed to, in normal times, would all meet in Geneva for developing these recommendations. And so the first iteration was published just a couple of weeks ago. We published both on the WHO website as well as in the BMJ. And it's all very cool. The idea is a living guideline and living systematic review and network meta-analysis. And, as new drugs and new practice changing elements in COVID come up, the idea is to offer ongoing insights and guidance for clinicians. So happy to provide you with the links, but I think it is a very cool project, which I'm playing a role in, but a lot of smart people that are helping to lead from societies around the world.
That's super cool. Yeah, so I'll definitely share the link with everyone listening on everywhere we put this podcast. I would love to learn more about that. Now, from the critical care side, what are some of the key takeaways right now of management of patients with COVID?
Unfortunately, as you've probably seen, in terms of interventions that help patients, the supportive care remains our mainstay of therapy. And so despite 8 or 9 months of research and unbelievable productivity at worldwide investigators, the best supportive care for critically ill patients is number one. The one drug intervention with fairly good data, and we made a strong recommendation for use, is steroids. Or corticosteroids for those that are requiring oxygen or mechanical ventilation. And so beyond steroids and supportive care, everything else is still incredibly uncertain. We most recently just offered a recommendation against remdesivir, a drug that got a lot of interest in the United States. Donald Trump himself was administered remdesivir when he was briefly admitted to hospital. But we found, at least as our group, that there was not data to recommend its use. So it really comes down to, again, supportive therapy and steroids. But I think that we're all developing a bit more of a comfort in managing these patients, all the processes involved in terms of PPE and transferring. And we've been working through lots of simulations and best care plans. I think, Sam, one of the nice things, big things this time around too, is that the concerns around PPE availability are less of a concern for us, which has provided at least a bit of a weight off our shoulders, I think. So, I'm certainly concerned with seeing the numbers where they're going in the last little while. I think we all are, but there's things to be reassured by based on what I mentioned. And the vaccine news is a sort of a light at the end of the tunnel as well.
Yeah, I wanted to chat about the vaccine a bit. And definitely very cool about some of the recommendations. I know, unfortunate that some of the drugs haven't panned out the way that we're hoping, but it's good news. We're learning to manage manage the patients with COVID a lot better. Now, going to sort of prevention and the vaccine, I think there's definitely going to be some logistic challenges with some of the vaccines that have been approved. I know the vaccine also out of China maybe doesn't have as much transport issue, but the ones that we're recommending today might have to have the cold storage. What are, aside from some of the cold storage, what are some of the challenges you think are going to come across trying to disseminate the vaccine? And we can also circle back and talk about some misinformation stuff, because I think at the end of the day, just speaking to colleagues, nurses, patients, family members, people are worried. People are worried about the vaccine, that they think everything has been rushed through. We're so productive and got through trials so quickly, and these are not ready for prime time, but are going to be given out. I know I gave you a mouthful there, but
no. I have feelings that I'm happy to discuss. The Pfizer vaccine is the one that's furthest ahead, and that's the one that we just approved as Canadian Health Canada did it in the last couple of days. And we're supposedly going to get 250,000 doses before the new year. And that's the one that has that big issue, needs to be at minus 80 degrees. Once it comes out of minus 80 degrees, it's only stable for 5 days, I think. So there's certainly issues around distribution. Moderna is the one that's next up, and one that Canada has invested in very early on, and we're promised to be sort of at the front of the line. I think we're going to see it approved the first week of January, and we have a lot of doses that we have bought into. Interestingly, it's Sonia Anand's sister, Anita Anand, that's the acquisition minister that's been dealing with buying all the vaccines. I don't know if you knew that McMaster connection. She's an MP for Oakville, I think. And Moderna, one of the advantages, it only has to be at minus 20 as opposed to minus 80, so less implications in terms of cold storage. I think there has been a lot of misinformation around the vaccine, and they have all been subjected to 60,000 patient randomized control trials, and which is quite strict. This is more robust data looking at these vaccines than we subject most interventions that we do to, and certainly more robust than previous vaccines that we've approved as well. So, I think it has been rushed 100% because dealing with the pandemic, but I'm not as certain that corners have been cut. In fact, I think that realizing that they're under the microscope is that they have actually not cut corners and tried to be as comprehensive as possible in addressing these vaccines. And the results are certainly promising. And so in a 60,000 patient randomized control trial, 30,000 get randomized to getting the vaccine, 30,000 to placebo, and then you look at the outcomes in the patients to try and see. And they have seen, both for Pfizer and Moderna, minor side effects, local reactions, feeling crummy, but no major adverse effects. The problem, Sam, is that there is still uncertainty. That's fine for 60,000 patients, 30 that got the vaccine, but you might still see rare side effects, maybe 1 in 100,000, 1 in 200,000 side effects, things like Guillain-Barré, that are not going to show up in the RCT and are only going to show up down the road. That's a possibility for sure. Rare, serious side effects, but that's also the possibility for other vaccines. They have not looked in children and other pregnant women and other specific populations. And, I mentioned to you, I think before we started recording, is that at least initially, these vaccines will not be administered to children or pregnant women or otherwise. That's a surprise to some people. They're not approved in kids. Maybe down the road that will change as we do more testing. But it's not going to be the case up front. And then, we know about immunity and impact in the short term, because the data is sort of looked at 3-6 months, but what about 1-year outcomes, 2-year outcomes, and how long does immunity last? And could there be side effects that persist long term? I think it's incredibly unlikely, because we have never seen that before in other vaccines, that they have long-standing impact and cause future harm down the road. So incredibly unlikely, but we don't know because we haven't followed along. So is there uncertainty around the vaccines? Certainly. But have corners been cut in terms of the evaluations to this point? I think it's actually the opposite. I think that they have done a very comprehensive job. And if you ask me personally, I'll be lining up in January, which I think will be the time for frontline healthcare workers to get vaccinated. I will be lining up to get the vaccine myself. My wife will be as well. appreciating that there is some element of uncertainty persisting.
That's great. That was very helpful. Yeah, I'll be right there with you, Bram. We'll roll up our sleeves and I'll wear my sticker of, yeah, it's interesting though. What is that going to look like, right? How do they track who got the vaccine or not? I think, in Canada, or we might be a little bit more behind in terms of tracking vaccinations. And I think, there might be a very great opportunity for Canada to wake up and put together a system of, tracking all types of vaccinations. Every time I have to do my annual renewals and so on and get privileges, I have to go track down, old measles vaccines and paperwork and TB skin tests and all these sort of things where there must be a better way and a nice, better centralized system. So anyone listening who is tech savvy, maybe there's an idea there for you.
Yeah, absolutely. And, so all the implications, like I've seen Qantas, the Australian airline, is going to say they need a certificate before they'll let you fly. Like, I think the implications and how we deal with this in society are still very, very unclear as well. It will be interesting to evolve and see how things go. I think the reassuring thing from a hospital worker is that even if we start vaccinating our vulnerable populations, maybe it's not going to make COVID go away, but it will decrease the impact on our hospital use and our admitted patients and our ICU patients, which is it's huge.
Right, and that's the key, right? We just keep everything running and not overwhelm the system, and everyone can start getting back to some normalcy. That'd be amazing. And wrapping up, I'm very cognizant of your time, and I appreciate everything you shared with us today. I know you well, and one thing maybe the listeners don't know, anytime you're outside and you hear an airplane overhead, I could just look up and I can say, Bram, what airplane is that and where's it going? And you'll nail it. You'll know the model. And so how did that come about? And what's your interest with the airline industry?
Yeah, it's been a relatively recent interest, Sam. My wife gives me a hard time about it all the time. My head's always up looking into the sky. Although I'll tell you, it's been harder lately with not as many airplanes up. And I haven't flown in 9 months. The last time I went anywhere was Orlando in February for a conference. It kills me. I love traveling. I love, it's hard being away from the family, but I love being on airplanes. So it's been hard, but I don't know. I'm very fascinated by the airline industry, the logistics behind making sure that planes get from here to there, and especially for a large airline like Air Canada or something like this, and how they sort of plan everything. And it's hard to say, but there's a very cool app. I don't know if you've seen this before. I'm sure I've shown you before, where you can. It's called Flight Radar 24. I have no financial investment in the company at all, but you can pull it up, and any airplane you see up in the sky, you can see, it's going from Boston to LA, or it's going to Europe. And I find it very cool to track these things along. Very nerdy, I'm sure, but listen, everyone's got their interests and their diversions that they need from COVID and from work, and this is certainly one that I get excited about.
No, I love it. I think we share definitely the same interest in traveling, and I definitely love the airline industry as well. And I'm hoping that soon we can see a lot more planes flying overhead, and that app can be bustling again with a whole network map going. Yeah. So hopefully, hopefully the vaccine kicks in and some of our restrictions and first line things that we can do, and mask, wash your hands, keep your distance, and we can really keep the world safe and get back to some normalcy, hopefully very soon.
Let's start planning next family trip with the Elfassys and the Rochwergs. We'll see where we might want to go next.
I'm in. It. Excellent. Thanks again, Bram. This was terrific. I think our listeners got to hear quite a bit of great information about social media, about COVID, intensive care, and the upcoming recommendations that you just put together with the WHO and vaccines. And hopefully we'll have some better conversations in the near future. Thanks again.
Thanks again, Sam, for the opportunity. My pleasure, and I look forward to the next time we can chat.
Great.